Hi, my name's Manoj, Krishna. I'm a spine surgeon. And today I'm presenting a case of spinal stenosis. This is a gentleman who's 76 years old, and his main problem was difficulty playing golf. We couldn't get an MRI scan because he had a pacemaker, and so we got a CT scan instead, as seen here. And the cross section of the spine shows quite severe narrowing of the spinal canal. So the nerves are being pinched by a combination of hypertrophied facet joints and ligamentum flavum, which pinches the nerves in the spinal canal. Patients typically present with leg pain or heaviness on walking, eased on sitting or bending over. Um, After trying non-surgical options, we decided to operate and did a laminectomy at 3 levels combined with stabilization of the spine. This is a dynamic stabilization system which allows a jog of motion in the rods. Uh, this is a view from the front, and you can see the 2 rods and the pedicle screws. Surgical time is about 2.5 hours, and hospital stay is typically 2 to 3 days. Patients do well, and age is not a barrier to safe surgery. Here's Fred telling a story.
Good morning, Fred.
Good morning.
So, how old are you, sir?
I will be 76 in May.
Okay. Please tell me a story about your walking problem, which we finally diagnosed as spinal stenosis.
Yeah, I noticed that in late 2012 that I was finding it more and more difficult to walk. It wasn't that I had pain, it was just the legs refused to operate as they should. And I found that I was gradually coming more and more to a halt, particularly on the golf course, which is one of my favourite pastimes. So in 2013, I had to resort to a drive-on buggy because I couldn't walk. I could swing, but I couldn't walk. But the walking became less and less tolerable, and that's why I came to see you.
And you said at the end you couldn't walk more than 50 yards?
I couldn't walk to the gates at the end of the drive 2 days before the operation.
And you said actually that there wasn't too much pain, it's just that the signals weren't getting through to
The
your
signals were just not getting through to my legs. You know, I mean, if there was a pain, it was kind of a dull ache in the buttocks that worked its way down towards my knees. But that wasn't anything significant in the sense that my legs just seemed to get heavier and just wouldn't operate.
Now, when you saw me, we did an MRI scan and
Yeah.
we diagnosed a condition called spinal stenosis.
Yes.
Where there's a pinching of the nerves in the back.
Yes, you found that 3 of my discs had virtually collapsed, yeah.
And then we mentioned the possibility of surgery, and it created quite a lot of anxiety. So talk me through that and how you dealt with that.
Yeah, it did cause me a lot of anxiety because having spoken to you and getting a really positive sense and attitude towards it, the more you think about it, and I did rather silly things like I looked things up on the internet, and then you realise that there are possible issues that could arise. But my attitude was, this is where I am. The only way I'm going to move forward is to take the advice of you, Mr. Krishna, and surgery was the only option to see me right.
So your surgery was 8 weeks ago, where we did a decompression and stabilization.
Yeah.
So talk me through the surgery and your recovery, please.
Well, what I remember is I came into Nuffield Teesside on the Friday afternoon. I was met by Mr. Callier, the anaesthetist, who's a jolly chap, and he put me immediately at ease. And I went down with your spinal nurse, Julie, and it was fine. And when I came round, it was pretty much late on the Friday evening, and I felt very, very comfortable. Very, very. I couldn't feel any pain or anything. And then on the Saturday, I was feeling better. They took the epidural from my back so I could sit up. And then I actually got out of bed and sat in the chair next to the bed, feeling really good. And then when you came and said, Fred, let's go for a walk around the hospital, I was absolutely amazed. But the first 3 or 4 steps to the door of the room before we went into the corridor, I immediately had this phenomenal feeling that I was back to normal. I was walking again. It was absolutely a miracle as far as I was concerned, and so it's continued.
So you're now 8 weeks from surgery.
8 weeks from surgery. I'm walking an awful lot. I'm exercising an awful lot in accordance with what the physio has given me. I'm looking forward to a summer later of golf again, very optimistically, and as I repeat myself again, it's a miracle as far as I'm concerned.
Okay. Well, thank you very much.